Welcome from Caregiver Cloud to our course on bowel elimination. The term bowel refers to the intestines, which are below the stomach in a person's body. The primary function of the bowel is to remove solid waste from the body. Professional caregivers are in a position to observe patients. A patient with abnormal bowel functions can indicate developing problems. Observing and reporting any changes in the bowel function of a patient is very important as it can help prevent serious problems. The solid waste removed from the body is also known as stool or feces. The process of eliminating solid waste from the bowel is called defecation. Defecation should not be difficult or painful for a patient. With aging, problems with defecation can arise because of changes in the body, illnesses, and any medications that the patient may take. Let's review bowel mechanics. The stool is formed in your body in the large intestine. The large intestine is located in the abdominal cavity just above the waist. As stool is formed in the large intestine, it moves down into the rectum, then is excreted through the anus. Now let's discuss problems that can occur in the bowel. An abnormal bowel movement that contains blood is often described as tarry. A bloody stool is not typically red, but has a tar-like appearance because when blood mixes with stool, it turns a blackish color. If you notice tarry stool with a patient, you should notify the nurse or supervisor immediately. Blood in the stool can be a medical emergency. When a patient has had no recent bowel movements and complains of abdominal discomfort, they may have constipation. Signs of constipation that you may recognize in a patient would be less than 3 bowel movements in a week, difficulty and straining when passing stool, passing of hard, pellet-like stool, and pain with defecation. There is no correct number for the amount of bowel movements a person should have in a day, and being regular is different for each person. Some people may have 2 bowel movements in a day, and others may only have 3 to 4 per week. It is important to recognize what is normal for each patient, listen to any patient concerns, and be proactive in treating constipation before an even more serious problem develops. A medical emergency that can result from untreated constipation is fecal impaction. A fecal impaction is hard stool found in the lower bowel that prevents normal passage of feces. When caring for a patient, the first symptom that you may notice is a change in their usual baseline bowel pattern. A patient with fecal impaction will usually have a constant urge to defecate, but will only leak fluid from the rectum when attempting to have a bowel movement. A fecal impaction is painful and should be reported to the nurse or supervisor immediately. The key treatments for constipation are foods high in fiber and increased fluid intake. Water should be encouraged as this will help bowel regularity. Exercise can also help maintain good bowel movements. As a professional caregiver, you should encourage your patients to attempt a bowel movement after each meal. Never force your patients to wait to use the restroom, as this can lead to constipation. As a nursing aide or home care aide, your key function will be to observe patients and to report findings to the nurse or supervisor. When observing bowel function, you will need to observe the color and consistency of the stool. Normal stool is brown in color and formed. If the stool is an abnormal color or is hard or loose in consistency, this should be reported to the nurse or supervisor. You should also observe the frequency of stools. If a patient is going more or less frequently than usual, this can be an early sign of a developing problem. A patient who is unable to control their bowel movements is considered to be incontinent. The inability to control gas or stool is incontinence. Incontinence is a symptom of another illness. It is not an illness itself. Incontinence is not life-threatening, but it can have a major impact on a patient's emotional and mental health, as well as their self-esteem. Incontinence can result when a patient has the urge to go to the restroom, but is unable to go in time. Other patients may have no sensation of needing to have a bowel movement at all. Risk factors that make a patient at a higher risk of developing incontinence are nerve damage, such as in patients with multiple sclerosis, diabetes, Alzheimer's disease, and physical disabilities. Gender also impacts incontinence, as women are more likely to be incontinent than men because of complications they may have had during childbirth. When caring for a patient who is incontinent, be sure to provide adequate skin care. When a patient is incontinent, the stool that is on their skin can cause injury and irritation. Patients are generally at high risk of skin breakdown, such as pressure sores and ulcers. So when providing care to an incontinent patient, be sure to thoroughly clean the skin and apply any creams and barriers that may be ordered to protect the skin. If you notice any open areas or redness on the skin, report it to the nurse or supervisor immediately so proper treatment can be initiated. In conclusion, the function of the bowel is affected with aging by a general slowing down of the gastrointestinal tract. When this happens, it takes a longer amount of time for stool and liquids to pass through the organs of the gastrointestinal system. This natural aging process can increase a patient's chances of developing constipation. This concludes the Caregiver Cloud course on bowel elimination. Copyright 2016, all rights reserved, Caregiver Cloud, LLC.